Okay, hello everyone, and apologies for the technical difficulties. So as I was saying, this is joint work with some colleagues in Melbourne University, Cornell University, New York, and Newcastle University in the UK. And it's something we've been working on the past year, looking at the wider issue of, if you look at the social determinants of health, rural areas have kind of fare worse, but then on average, they have better health outcomes. So it's kind of looking at different reasons why this might be. Okay, next slide, please. So in the UK, traditionally urban areas have higher rates of poverty than rural areas. And this is the exact opposite to what you find in other countries, such as the United States and Australia. And there's a number of reasons why this might be. Part of it is just geography, that the US and Australia are much larger countries and rural areas are much more remote, which impacts on their desirability for places to live, kind of as touched upon in the keynote speech earlier this afternoon, where in the UK, since it's a much more compact country, that you can live in a rural area and work in an urban area. And also, so many people choose to do that because rural areas are nice places to live. Next slide, please. So there are a number of reasons why we think that rural areas have lower poverty, as some of the things I just mentioned. So one of them as well, because of this kind of being able to commute from rural to urban, is the demographic characteristics of people living in rural areas. So you have kind of people with high skills who want to live there, and then they either work remotely or commute in. And the other aspect, which we're not going to touch upon in this research, but there is a large body of literature investigating it, is the industrial composition of rural and urban employment and what that means for who's working where. And then the other explanation is differential effects of social and economic policies on rural versus urban areas. And then this kind of touches upon some of the issues raised in the leveling up agenda, and kind of thinking that policies have heterogeneous impacts by place. And if you don't consider that, then by impacting national policies, you're going to have differential outcomes, which might then exacerbate existing social inequalities and health inequalities as well. Next slide, please. So, as well as been mentioned by other talks today, over the past 10 years, between 2010 and 2020 specifically, we've had a period of austerity, which has meant reductions in local government spending. And in many cases, these reductions in local government spending have been highest in more deprived areas, particularly more deprived areas in the north of England, such as places like Blackpool, Hartlepool, Middlesbrough, etc. And there's been two studies, one by Hastings et al., that suggested that the impact on poverty of cuts in central government funding welfare reforms have had differential impacts between rural and urban residents, because due to the natures of these cuts, in many cases, there have been greater cuts in more urban areas, which will then have impacts on provision of services and economic growth in these areas. Whereas May 2020, in their study, they said that actually it's not an urban-rural thing, it's a deprivation thing. So more deprived rural areas, such as you find kind of in Cumbria, would be just as equally hit as those more deprived urban areas, so that by kind of making this differentiation between urban and rural, you're kind of missing the point. Next slide, please. So then, given this context of kind of the ambiguity between how austerity has impacted on place, particularly the differences in urban and rural areas, we've decided to, we were hoping to add to the research by looking at the likelihood, firstly, of being in poverty, which we measure I'll talk more about in the next slide, as the standard definition of 60% below the median income, and how that compares between people living in urban and rural areas, and as well kind of the characteristics associated with that, the likelihood of being in poverty. And further from that, then if we do find a significant difference between the likelihood of being in poverty if you live in a rural or urban area in England, we look at, we do decomposition to look at how much of that is explained by individual level characteristics such as educational attainment, occupation, employment status, and how much of that is caused by differences in social policy, particularly related to austerity cuts, so reductions in local government spending at the local authority level. Next slide, please. So as we all have been discussing, and we all know that since it's celebrating 10 years of the Understanding Society, it is a longitudinal panel. But in our analysis, we focus only on 2018 because we wanted to look at the cumulative impact of austerity. So we thought that it'd be best to look at it kind of from the last year where austerity policies were definitely in place, rather than looking across the panel as well to deal with issues related to attrition. Next slide, please. So then just to give a bit more explanation of the data that we use in our analysis. So we use the secure access data from Understanding Society survey, which contains the local authority district code. And then by having this code, we link the data from Understanding Society with data on core spending power of local authorities over that time, as well as information collated by the Institute for Fiscal Studies on spending, as well as the impact on individual income of welfare reform. Next slide, please. So as I briefly mentioned, our key variable is poverty, which we measured as having a household having 60% less than median income. And we use annualized net equivalized, and we control for, so this income is after housing costs, because basically after housing costs can capture differences across the country, which changes the spatial composition of poverty. So if you, I guess, don't include housing costs, then you have people in London look less poor, whereas when you do include housing costs, then the distribution of poverty changes, where you have a higher proportion of people in poverty in London compared to other places. And the same thing for the Northeast, that kind of changes, where you have a higher percentage people in poverty when you don't control for after housing costs than when you do control for after housing costs. Next slide, please. So our key explanatory variables are rurality, which is also a binary variable, which equals 1 if the respondent lives in a settlement with less than 10,000 people. And that's based on the National Statistics Rural and Urban Classification of Output Areas. And just to note that this definition changes slightly between Scotland and Wales, which is why we focus the analysis on England. And we also, the individual characteristics that we control for are age, household tenure, housing type. So that's kind of if they're owned, mortgaged, rented, a council tenant, employment status, so if the person's employed or not, the type of contract if employed, so if it's full-time, part-time, a permanent contract or fixed term, and educational attainment. And the area level characteristics that we include are the percentage decrease in core spending power between 2014-15 and 2018-19 at the local authority level, the percentage decrease in service spending between 2009-2010 and 2016-2017, also at the local authority level, and the expected decline by 2020-2021 in per capita income as a result of cuts to welfare benefits at the local authority level. And we also include unemployment rate at the local authority level, and that is for 2018. Next slide, please. And so just to make it easier for everyone to see, this is just a summary of some of the characteristics of our sample. So our rural sample consists of 901 individuals, and 78% of them own their home or have a home with a mortgage. 63% of people in rural areas are on permanent contract, and 34% are university educated, where this compares to our urban sample, which consists of 7,468 people. 70% of these people own or mortgage or have a mortgage on their home. 56% of them have a permanent contract, and 28% are university educated. So you can see there are some differences, but we didn't test if they're statistically significant between urban and rural residents. Next slide, please. So this graph just shows the real-term changes in local government service spending using the 2005 Index of Multiple Deprivation to determine which areas are deprived and not between the periods 2009, 2010 to 2016, 2017. So we can see that the blue line there are urban residents, the yellow line are rural, and the grey line includes London. So we can see that there was a larger decrease in spending for more deprived areas than least deprived areas for both urban and rural. You can see that they're fairly similar, but there are some potentially slight differences between urban and rural at the different quintiles of deprivation. Next slide, please. So then this graph here shows the decline in per capita income as a result of welfare benefit cuts, also using the 2005 Index of Multiple Deprivation to classify deprived areas. And we can see that in this first graph that there's not much difference between urban and rural areas, but then looking at the second graph, that's between that there is a divergence between urban and rural, and that in fact that it's slightly worse for urban than for rural. Next slide, please. So then for our analysis, what we do is we start by estimating the association between living in a rural versus urban area and the likelihood of being in poverty using a stepwise logistic regression. So what we do is first we add in individual characteristics, and next we add in kind of the contextual area level factors to see how the coefficient on our rural variable changes. And then we do an Osaka blinder decomposition, where we decompose the differences in poverty rates between urban and rural populations in 2018. So we can kind of determine how much of this gap between the likelihood of being in poverty between rural and urban residents is explained by individual characteristics, and how much is explained by differences in kind of policies, specifically austerity related policies, to changes in spending at the local authority level. Okay, next slide, please. Okay, so then this shows some of the basic results. I didn't show them all just because the table would be too big. So the key results from the Logit equation. So we can see that when we have only the rural dummy, that those who are in rural areas are significantly less likely to be in poverty. When we include individual characteristics, that it gets slightly larger, and then, it gets slightly smaller. And then again, it gets closer again to 1 when we include local authority characteristics. Okay, next slide, please. So then from doing our composition, what we found is that the gap between the likelihood of being in poverty, which I didn't show, it was approximately, the mean is 9.2, and that gap, 43% of that gap is explained by individual characteristics, and 30% of it is explained by local authority characteristics or kind of differences in policy outcomes. Next slide, please. So overall, what we found is that being a rural resident compared to an urban one is associated with between 0.52 to 0.75 lower odds of being in poverty, and that individual characteristics explain 43% of this gap, and social and economic policy and its differential impact on place explains 30%, and that is the same as is explained by unobserved or unexplained factors, which we don't control for in our model. Okay, next slide, please. Okay, so then what does this mean? So one of the things is kind of that was also touched upon in the keynote is kind of how to attract high-skilled people to more deprived areas, regardless of urban or rural locations. So thinking about kind of going with May's argument from the earlier slide that it's not necessarily an urban-rural thing, but if it's a deprivation thing, then you just want to kind of make these areas attractive to high-skilled people. And one of these things, I guess, post-COVID, well, going forward, that if more people can work from home, that you can kind of create some incentives to get people to live in rural areas. Like currently there is some incentives in Portugal where they're trying to get younger, more highly educated people to live in rural areas by offering them free rent or 10,000 euros to put a deposit on a house as a way to kind of incentivize highly skilled people into depopulated rural areas, and thinking about kind of can offer some sort of same incentives to get people to live in kind of more deprived areas to boost the skills of the local population. And as well, a key point is the differential impact, both spatially and economically, of policies. We found that 30% of the urban-rural poverty gap can be explained by differential impacts of social policy and what that means for leveling up, and how the government can kind of use any additional money to make sure that it's targeted so that the policy will have the most impact in those places that need the most support. And I think, next slide, please. I think this is the end though. Yeah, that is the end. So thank you, everyone, and sorry for the technical difficulties.